Good afternoon, everyone. Today we're going to discuss the myoarchitecture of the external anal sphincter using diffusion tensor based imaging, MRI. So a bit of background. So the external anal sphincter anatomy. So medical textbooks of anatomy often fail to reflect the controversies or new developments in anatomy, so creating the impression that anatomical knowledge has not changed. So they treat anatomy as a static science. So whatever is known and is faithfully and comprehensively recorded in the great textbooks of anatomy. However, some controversies are putative clinical importance. Besides, any topic is not immune from reappraisal if prompted by a question stemming from physiology, pathophysiology, or clinical practice, even if clinicians have endorsed it. One such issue is the anatomy of the external anal sphincter, where its actual structure has been of concern mainly to specialist colorectal surgeons, but for others, change in anatomy has bore little on how they practice. However, the former anatomy will not only shed light onto the pathogenesis and treatment of anal fissures and fistula in anal, and how sphincterectomy is performed, but its importance with respect to the mechanisms of anal continence and defecation. So this is the actually schematic of from 1899 of the pelvic floor, the myology of the pelvic floor. So the traditional teaching tells us that similar to the other smooth muscles, the sphincter muscles in the anal canal, the external sphincter, as you can see here, is a circular donut-shaped structure located outside the internal anal sphincter. So the point of like tension is right here, the perineal body. Nobody really knows, is it circular? Are the fibers like crossing? So nowhere else in the body does skeletal muscle assume a circular configuration. Moreover, it raises a question in embryology as to what induces an isolated mass of mesoderm tissue to arrange itself into the shape of a donut. Now, studies from our lab indicate that the EAS is shaped like a purse string, in which the muscles from the right and left side of the EAS cross into the ventral midline structure of the perineal body, and they're attached to the pubic rami. So this is the anatomy of the pelvic diaphragm from a male subject. You can just see the central tendinous point of the perineum. So it has been stated that many of the muscles of the perineum either take origin or insert into this point. This, however, is not the case. It was found that many of the muscle fibers became fibrotendinous at this point, that they neither rise nor insert into this area, but they can be traced directly through the central tendinous point of the perineum, often resuming their muscular configuration again to pass on to the various point of attachment. So this is probably due to the action of body mechanics in this point as the fibers cross and rub against each other in this particular area. Now, the gold standard to assess the morphology of the external anal sphincter currently in clinics is using the 3D-dimensional ultrasound imaging. So based on current thinking of the AS, is like the AS is a donut-shaped muscle, and they detect the pathophysiology based on the disruptions or breaks in the circular shape. And what you see here is a ultrasound image of the anal canal using a 3D-dimensional US volume. You see the cross-sectional axial images along the length of the anal canal every 1 millimeter distance. So each line corresponds to one of these images. So the most common site of damage is in the middle here, is the 11 to 12 o'clock position. Interestingly, the area of the perineal body. However, the external anal sphincter is shaped like a purse string. So it is possible that damage to it may be in the bulbospongiosus and transverse perineal muscles, which is not assessed by current imaging techniques. So how do we assess the microstructure of the EAS? Here where the like MRI technique comes in. So there's this technique called diffusion tensor imaging, which is an advanced magnetic resonance imaging that provides detailed information about tissue microstructures, such as fiber orientation of the muscles, axonal density, and the degree of myelination. So DTI is based on the measurement of the diffusion of water molecules, because we are like 70% composed of water. So how does biological tissue show diffusion? So molecules are in constant random motion. This motion is called Brownian motion. Now we can differentiate between different tissues based on the motion of water molecules within this tissue. Now in gray matter in the brain, diffusion is unrestricted and is isotropic. So it's like random in all directions. But if you have a muscle and you have a fiber tissue like white matter, diffusion is restricted, and they call it anisotropic. Okay, as you can see, the motion is in a certain direction. Now, so if you have a patient and you put them through an MRI, okay, and you change the gradient directions of the MRI at like a number of different angles, you can actually see motion of these water molecules for each of these magnetic changes of direction. So as the magnetic field changes direction, the water molecules will diffuse in certain directions. So, and from this kind of motion of these water molecules within the perineal body, we can actually guess the internal structure or the morphology of the external anal sphincter. In our particular case, we have 32 different magnetic directions. So we have 32 different diffusion slices. So the reference slice, we have got the B0, which doesn't have any gradients, and we have 32. So it's the same image, but what you don't see, the water molecules diffuse differently because the gradient direction in each of these images is different. So if you assume one, let's say, pixel in one region of this particular muscle, this one pixel, we have 32 encoding directions, right? Because we have 32 different magnetic fields applied to it. Now, if this pixel is located in another muscle, which is directional, as we discussed earlier, its diffusion pattern will be restricted. So if it's a free, unrestricted motion, it will be isotropic. So we can actually model it with a sphere where the lambdas are equal. But if its diffusion is more in one direction, we can just actually have an ellipsoid to model this kind of random motion. So what the DTI map is, actually, if we encode this diffusion directions using color, so red will indicate directions in the x-axis, the right to left or left to right, green indicates directions in the y-axis, front to back or back to front, and blue indicates directions in the z-axis, foot to head direction or vice versa. So you can see different regions shown in the blob shown in red here. So in each of these voxels or regions, the water molecules will diffuse differently. So whether they're a sphere or elongated is based on the structure of the muscle fibers within those regions. So a technique to actually gather fiber orientation from these MRI images is called tractography. So what is commonly used, because it's called the deterministic tractography. So they say, okay, if the diffusion of, let's say, water molecules in muscle tissue is directional, so it's an ellipsoid, how about we just track the longest one, which is the direction of maximal variance? And let's say we have 2 points. Starting at one point, we just trace these lambda ones along each voxel till we get to their point. So we will build a tract based on the direction of maximal variance. And currently, actually, in brain imaging, there have been like, a lot of methods using deterministic fiber tracking and get beautiful images. But where this technique of deterministic fiber tracking fails is that what happens is within a voxel, we have crossing, kissing, merging, or diverging fibers because it's based on a simple Gaussian model, so it doesn't account for any crossing. And the problem we have within the external anal sphincter in the perineal body, actually the muscle fibers might be crossing. So we could not use this kind of method as it would give us erroneous results within the external anal sphincter. So what are the solutions? Another solution is like to use more like a diffusion directions rather than 32. How about we use 256? Or use a probabilistic model rather than a deterministic one to reconstruct all the tracks at once. Okay? And there have been like, several like acquisition methods like a Hardy, diffusion spectrum imaging, ODFs or fiber ODFs, but we didn't have the instrumentation for that, and actually they're hard to do, especially with like, you have the patient motion. A patient has to be restricted like they're like, in the MRI scanner for 45 to 1 hour. So there are certain limitations when it comes to practicality of these methods. So in our methodology, we used global tritography algorithm, which is a probabilistic model of simultaneously building all the fiber tracts within a particular region. I'm going to show you experimental design. So we use 10 asymptomatic nulliparous females, 28 years old. We use the GE Medical System 3 Tesla from Milwaukee, Wisconsin. 3 millimeter slice thickness, 0.4 millimeter spacings. We acquired like 32 non-collinear gradient directions, and 24 to 30 slices were acquired in the axial and perpendicular planes to the anal canal. This is the results. We have a female subject, 24 years old. First, I want to show you the results of a deterministic fiber tracking. So first, we have to identify the region of interest prior to like calculating the fiber tracks. So you can see the pelvic floor bones and the perineal body region and the external anal sphincter. Within the region of interest, we used deterministic fiber tracking to reconstruct the results. As you can see, again, the perineal body shows a circular morphology, but this is problematic because actually the method that was used to build these fibers only takes into account one of the lambdas out of the three, so it fails to resolve any crossings within this region. So if I zoom in here, as you can see, again, we get this circular shape. Now, if you use the same subject, but now we use a global tracking method, as you can see, you beautifully can see actually the crossings within the perineal body, right? So if you remember the schematic I was showing you guys earlier, the perineal body here resembles a lot similar, looks very similar to the one of the schematic of 1899. And if you actually build the longest fibers, the 98% of fibers, you can see that the fibers in the superficial EAS stemming from the raphe, unlike the puborectalis, do not loop around the rectum. Okay, instead they decussate into the perineal body and can be traced into the bulbospongiosis and transverse perineae profundus. And actually, you can rotate this model, and you can see better how the fibers actually act like a purse string within the perineal body and cross. And you can zoom in, and you can see crossings within the perineal body. You have a second subject, 24-year-old female. First, I'm going to show you the results from the deterministic tritography. This is the MRI of the region and the region of interest that was used to build the mask for the DTI. The result first is the deterministic fiber tracking. You see there again the circular structure. So again, the algorithm fails to resolve the crossing within this region. There's a zoomed version here. And you can use the same method, but now this time we use a global tracking. And you can see, again, beautifully here, the crossings within the perineal body. And again, you can rotate this structure and beautifully see in 3D how the muscle fibers kind of cross like a purse string within the perineal body. Now a 30-year-old female, I'm going to show you the deterministic. So the anus, the perineal body. So you can see the caudal and cranial. You can beautifully see the crossings. Another 21-year-old female. I'm going to show you only the results using fiber tracking. As you can see in all of the subjects, you can see beautifully the crossings of the fibers within the perineal body. And this was the same in all the other 6 females. So in conclusion, the microstructural anatomy of the superficial muscles of the perineum that includes all components of the purse string morphology can be beautifully visualized using DT imaging via global fiber tracking. These images reveal crossings of muscle fibers in the perineal body, transverse perineum, and bulbospongiosis muscles. Studies are in progress in our lab to determine if MRDTI-based fiber scintigraphy can determine the precise site of damage in the purse string morphology of the external anal sphincter in patients with anal incontinence. Thank you.